So really the gene therapies kind of checked all the boxes for me. It allowed people to have more sovereignty and agency over their own health and genome. It allowed better access to medicine, and it allowed people to, including myself, to explore what it's like to take on new genes.
This is a transmission from the future, from a civilization that crossed the threshold into optimal life. The path to Utopia was messy, full of experiments, failures, and flashes of insight. These are fragments from that journey, conversations with the thinkers and builders who reimagined how we live, connect, and evolve. Welcome to Utopia in Beta. Paradise began as a prototype.
Hello and welcome to the Utopia in Beta podcast. I am here in Austin at the Minicircle office with founder and CEO Mac Davis, and I'm very excited to talk to you about regulation around biotech and where we're going, because you guys are like the pioneers of testing out new kind of regulatory zones and doing some really interesting stuff with that kind of freedom. So maybe we can start with you kind of introducing yourself, introducing Minicircle, and we'll go into all of the rest of that.
Sure. My name is Mac Davis. We founded Minicircle, me and my partner, Walter Patterson, back in 2019. After I spent about 5 years of focused research on trying to find what the ultimate biotech platform offering could be. And so, when I was a kid, I had spent most of my time on the internet reading scientific papers, reading history, and I was super interested in the history of information and information theory and the ways that people learn to encode, express, save, transcribe, edit, and share information. And so, originally this kind of started with language and evolved into cuneiform, written language, money, address systems, and then eventually, the internet, email, stuff like that. So I got into crypto very early because it was the next obvious step in how humans transfer information and coordinate globally. And after getting into crypto, I was like, okay, this is awesome. This is a really functional new kind of money. We can do new contracts. It's great that everyone has more sovereignty with handling their money, but I wanted something that was more impactful to personal health and personal experience and could really open up more of that. When I was a kid, too, most of my life centered on dreams. I spent most of my time dreaming. My waking life was quite boring and uninteresting, and I was mostly exploring the dream world, and I was like, wow, how great would it be if I could, or if we could share dreams directly, almost like movies, the way that people like to watch movies together and have that shared experience of what can often be a fantasy realm. So really the gene therapies kind of checked all the boxes for me. It allowed people to have more sovereignty and agency over their own health and genome. It allowed better access to medicine, and it allowed people to, including myself, to explore what it's like to take on new genes. When you inject these genes, try these new genes on for a temporary period of time, the Minicircle program is basically this way to inject circular loops of DNA into your subcutaneous fat, similar to the way people do peptides or insulin, and then that gene is absorbed for a year and it expresses in your body for a year. And there's so many wonderful genes. There's just everybody has a different experience of the world because of their genes. Everything is processed through that. It's kind of the way you move through the world. A lot of it is encoded in your genes and how responsive they are. So, every time I've tried a new gene therapy, it's kind of been a different shift on life. It's almost like changing your, text or your work into a different font. It's still kind of the same thing, same identity, but it's got a different shift on everything. And I think there's just so many awesome genes that people have that we can all benefit from.
And you've got two main therapies that are kind of out there, and like you got Follistatin, which is more for the cardiovascular health, if I remember correctly, and then Klotho, which is about to be launched to kind of like broader.
Yeah. So the first two gene therapies that we chose to test both on ourselves, because I wanted to create these and have access to them, and also get them out to the world and do clinical research, were Follistatin and Klotho. These are two natural human genes. They're in everybody. They're a part of human evolution and many animals. Follistatin is widely known to regulate body composition, muscle mass, body fat, chronic inflammation, and epigenetic age. And then Klotho is more associated with like kidney function, cognitive function, protecting the brain from aging, and also improving metabolism and fasting, and reducing calcium deposits in the body where they shouldn't be, which is a part of aging. So both of these genes had been studied for at least 30 years in animals in laboratories around the world by great scientists. There were thousands and thousands of scientific papers about them. People did population analyses to see, okay, different people have different amounts of this gene. What are their outcomes? What are their health outcomes associated with that? They did decades of animal gene therapy experiments. They're very well researched, and both of these genes were associated with lifespan extension in animals by 30 to even 40%. And then people that have more of these genes, animals that have more of these genes, also just have generally better health outcomes in all of those areas. So we pursued that. We wanted life extension gene therapies to be actually available to people everywhere, and these two seem to be the two safest, highest impact ones to start with.
Okay.
And we started our first Follistatin clinical trial in Próspera in 2021, I think. And since then, we have completed 5 clinical trials, 2 of them on Klotho, many of them also on Follistatin, and the effects have been astounding. People really seem to enjoy it. Follistatin improves neuromuscular function, which is great for sarcopenia. People lose muscle and neuromuscular function with age, and it just makes you get stronger, less inflamed. And then Klotho has some pretty incredible impacts on cognition. We've seen significant IQ increases, speed of processing increases, fluid intelligence enhancement, lots and lots of things I could say about Klotho. Love Klotho. It should be available soon to more people, but we're still working on researching it more deeply and being able to provide a reliable care experience for everyone that takes it. Also, because Klotho is the effects can be so psychologically significant and can allow your lifestyle to change so much. I think having context and support available around that makes a lot of sense.
Can you go into a little bit of kind of like an example of what you mean when it could change people's lives so much and how you can support that?
Yeah. So, I mean, when I personally first took Klotho gene therapy 2.5 years ago, it was definitely one of the most transformative experiences of my life. You know, first day, I remember waking up and going into my kitchen and sitting in the hallway and just seeing everything in my house extremely clearly. Everything was very clear. My vision was very wide. I could see every object that I knew in its fullness, and then also like kind of the space in between everything. And I remember getting up to my coffee machine and like making my espresso, which I had been doing every day before I took Klotho. And I was just hyper aware of just like every step in my mind going through that habitual process. Everything was, I just got a new perspective on everything. And I feel like every step of the way of that habit, I could just make a decision to change it. I could just shift. In the study of psychedelics and the brain, there's this concept called the default mode network, where it's kind of like the way your brain assumes things are and the way your brain assumes things should be. And it actually costs your brain and mind energy in order to make a change from what you have inbred your habits to be. But after taking Klotho, it basically cost nothing to just shift any habit.
Okay.
And I was hyper aware of the whole process the whole time. So that was really cool. And I think that day too, I listened to some music on my speaker system, and it was the most astonishing thing. It was like I had never heard music before, and this was my first time. And it was so beautiful, and I was just so much more able to hear it. I remember also, I had some early experiences with water, and I hate swimming. I hate large crowds of people. I hate it when it's hot outside. And I was like, wow, everything's new. I'm going to go try swimming in the local pool of Barton Springs that all my friends love, and I always hate because I hate people, hot weather, and being in water.
Yeah.
And I went in there and I just had a great time. I was just like, no pre-expected aversion. I literally was able to do it without reacting the way that I had always just automatically reacted because of early childhood trauma responses. Okay. So, I don't know, those are a few of the first examples of how powerful it can be to shift a person's mind. I've heard, we've recorded at least 60 hours of video testimony of people going through the experience from beginning to end. And I've heard these types of stories from many people. I've heard just astonishment, just waking up with perfect witnessing clarity, just a lot of reduction in brain fog, a lot of clarity in thoughts, feeling like returning, like rolling back your mind's aging by 20 plus years.
Wow.
So that type of opportunity is something that needs to be respected and used consciously. It's not just like, boom, here's your shot, now you're healthier, see you later. But it's also totally unique to each person, like what this means to you, what can you get out of it. So we're still looking for the best way to provide the therapy. I think there's a lot of ways Klotho can be used. You could use it to treat diseases, eventually, like vascular dementia or kidney disease. You could use it for groups of people solving problems together, or that want to engage together with a fresh mind. You could eventually, I think Klotho is a fantastic gene to give to an entire population of people because it improves IQ, it improves cognitive function, it gives people a freshness. It extends. It protects against aging. So I think, especially in this era of AI, people being afraid of basically humans losing relevancy, or even just individuals losing relevancy, and AI changing the world so much that people are left behind. I think it's really critical that our brains are adapted to the new circumstances, and that people can stay relevant through this.
No, absolutely. I remember when we first talked about Klotho, and it always sounded amazing. What was the first... Was there a specific moment when you realized that you wouldn't be able to start the development for these kind of gene therapies in the US and the US system? Okay, tell me about that.
There was a specific moment. So after we realized the plasmid platform was working, and then the way that the plasmid works is it's like a template vector. It's like a cassette. This is the whole concept. It's like a packet of information that you can basically put anything into. So, what that meant is if the plasmid does work, that implied that basically thousands of these gene therapies, maybe even more, would be expected to work. And so the way that drug design and FDA regulation has always been handled is like every drug is, a lot of times it's like treated as a completely new drug, and it may be the first time it's ever been in a human. And so like the marginal cost of running trials doesn't really go down. Every time you run a series of clinical trials, it will cost millions, even billions of dollars over time. And then none of that can carry over to the next one. But because this is an iterative template type thing, and we were using bioidentical human genes that had already been many times in clinical trials themselves, or had already been studied in animals for 20, 30 years, there's a lot of background research that had already been done. There's a lot of safety that was already implied, and I just realized we had to find some other option, because the technology was too advanced and too real to be allowed to potentially be left to die in research, as it has been for decades. These same life extension gene therapies have been sitting in freezers in academia for decades, while everyone's afraid to try them.
Okay.
So I looked for some other option. I was like, we need something else that allows this to fully grow and take on its own life. So I called a couple friends, who eventually immediately introduced me to Próspera. And we also had been exploring Ukraine. We had been exploring New Zealand, Costa Rica, and just a very interesting series of events. In Ukraine, the war started, so we couldn't do it there. In New Zealand, COVID started, so we couldn't do it there. And when I arrived at Próspera, it was amazing. My first day there, there were economists from the EU. There was the guy who designed the Estonian e-residency program. Basically, just every person I met was astonishing, and they're just so much on the cutting edge. There was the chief strategist of the Dubai Financial Zone.
Okay.
And I just really got the download on, okay, this is real. This place is beautiful. The vision is solid. And so I chose to begin our initial research there. And we also met up with the GORM clinic, which is the stem cell clinic that's been there for now over 10 years with Dr. Glenn Terry, and our experience with them was just fantastic, phenomenal. Still probably the best clinic we've worked with over the last 9 years. And
Yeah, so because you went to Próspera, you managed to do a clinical trial 8 months after kind of final. What was the timeline like, and how was? Because I've written about Próspera, but what was that like in practice to go into this new zone?
Yeah, I think I first showed up in March of 2020, March of 2021, something like that. And I had already created my company. I got an office there. We got connected with the clinic. We went through the insurance process. We went through kind of the regulatory process, and we recruited our trial, and we designed the IRB package, which if you're doing clinical trials, you always need to have a set of documents, a package that in detail describes what the study is, what the product is, why it has value, why the study should occur, who the physicians are, when does the study begin and end, and then you get approval from what's called an institutional review board, which is essentially a group of real adults that are not all doctors but come from multiple professions who can look at the research and kind of ethically agree that this is a good idea. So we prepared our first IRB package, got that approved by an international IRB, and then we started the trial, probably within 8 months. And it was really cool. We had some of the coolest people that I've met, certainly in the longevity space, that were excited to come down and try this new gene therapy that they have been wanting to try for many years in such a adventurous jurisdiction. We've got this like tropical island, and there's this crazy hotel down there and this clinic, and it was really, a lot of the first people that joined the trial, they were really kind of in it for the adventure, and they were longevity, just people that were so committed to longevity and health that they had basically done everything they could for 20, 30 years already. And this was kind of the next thing that they got to do.
It does sound kind of exciting and romantic, like going to this island in the middle of kind of the Caribbean Sea, and
And it's also, I think that's also, part of the consent filtering process, honestly. If you have to go through a multi-month process to evaluate that you're taking this experimental gene therapy that maybe has been tested in animals, but maybe less than 20 people have even ever tried it. You fly down, you spend days as part of this like adventurous research group in a special economic zone that's new on an island you've never heard of, off the coast of Honduras. Like you're really, it's hard to say, I didn't really commit to this, or I didn't really understand that this was a new thing. It's not like going down to Walgreens because your doctor is like, you have this, you got to take this. Okay, I'll take it. And you don't understand what you're doing.
No. And then since then, you've gone to some other jurisdictions which are kind of like testing out new ways to do regulation around biotech. Tell me about those, because there's less online and less research being done around.
There's most of what's going on in this type of space with jurisdictions changing is not online. Even Próspera, they were online but you kind of, I think in every jurisdiction, you kind of have to be there and be talking with the regulators, the government, the policymakers, the people that feel like they're stakeholders in the jurisdiction, even if they're not in government. You kind of have to be talking with them directly to know what's going on. Every place has totally different nuances. I think there is an inherent nature to, like, you have rules that are on paper, that are codified, that may be very old, that, you know, were certified by the legislature such and such time ago. And then there's the reality of, like, social approval. Anytime you enter a kingdom, if you want to do something novel there, then you kind of need the approval of the king or the kingdom. Like, they have to know what's going on. They have to be into it. And I think that it comes down to that in a lot of ways, even if you're in a fully democratic society that has all these bureaus and stuff. So, yeah. So, like, some of the new things that have been going on are, one, in the US, there is the Right to Try movement, which has made a ton of progress on both passing laws and actually treating patients over time and kind of getting into the rhythm of things, of realizing, okay, there are so many valuable experimental new therapies, and there are ethical reasons that people should have access to these. And it's up to an individual's right to try, especially if they have a disease that doesn't have an answer. Like, you can't tell somebody who, you know, has a terminal diagnosis, oh, you can't try this thing that might cure you because it hasn't been tested on tens of thousands of people first. I mean, this is one of the problems that we saw with HIV. HIV was a totally new disease. It was deadly. It caused a lot of suffering in the process of killing people. It spread rapidly. And there were just tons of people that were intelligent, well-informed, you know, capable of making their own decisions, that were willing to try new experimental HIV therapies, both if it could help them and even so it could help their community. Even if it was at greater risk to them, it was very common. People knew and were part of a community that, you know, if you contribute to research that finds a treatment for this disease, then you can help contribute to saving your whole community, everyone with the disease. So that's what we saw with HIV. But in the US, there's Right to Try, that different states are passing different laws. And then there's the federal Right to Try, which we've seen some interesting things going on lately. This whole field is just changing so rapidly. You know, even what is official, people don't even necessarily know. Just, 4 or 5 days ago, Donald Trump signed an executive order further pushing for the Right to Try, specifically around psychedelics, including ibogaine, basically for mental illness and regarding the possibility of psychedelic therapies for people with mental illnesses and for the VA, for veterans, to have national priority access, priority review approval, and then for any psychedelic drug that was previously Schedule 1 that's been through a Phase 3 trial, for the DEA to immediately consider getting a scheduling waiver or unscheduling the drug. So that's huge. We had actually just hosted an event here in Austin with the same people that ended up in the White House 5 days ago behind Trump as he signed the order, which was really funny.
That's really cool.
And then, I think the Middle East is making they were making a lot of moves. I think they still are, obviously, with the current geopolitical situation. Geopolitics military actions on the national scale affect every aspect of the economy. So we'll see how things go later in the year. Obviously, Saudi Arabia made a big announcement on Evolution, which is something like a $400 million pledge to invest in life extension technologies. Japan is making a lot of moves. They have a new president. They have a new political party that's aligned with the president. All the elections were 4 months ago. They'll be in power for 4 years. And they are serious about affecting their demographic decline problems. Japan has an aging population. Their fertility rate, has been low, and it's really an existential issue for Japan to keep existing. For them to do something about biotech, aging, and fertility. So over the last 10 years, Japan's been making a lot of improvements and moves toward allowing expedited and earlier access to regenerative advanced biologic medicine. But I think only this year is there more of a turning point where for the first time induced pluripotent stem cells were approved this February. 2 of those therapies that were under development for over 10 years. Yamanaka was a Japanese scientist. 2 of the greatest discoveries, maybe the 2 greatest discoveries ever made in the history of medical aging science were made by 2 currently living Japanese scientists,
Wow.
Dr. Yamanaka and Dr. Kuro. Yamanaka discovered basically the mechanisms that cells use to reverse aging. Like when you conceive a child, you have these adult cells, and when they merge, their age goes down. It even goes below what you would expect a 0 age to be through measurement, and then development starts to happen. So you go from age 0 back up, and then that cycles, and then you start over. How did these cells do that? Yamanaka basically discovered how to turn any aged human cell into a younger version of itself.
Wow.
So that was in 1990. Similarly, Dr. Kuro discovered Klotho in 1991. They only actually published the paper on it in 1995, 1997. But ironically, Japan, who's been so conservative about allowing new medical research to be getting to its people, also made 2 of the greatest discoveries in medical aging. And they are at some of the greatest risk of losing their culture. But this year's been a huge turning point, both for Japan, for the Middle East, for Right to Try in America, and then the Bahamas. Finally, the Bahamas, they had a very successful regulatory initiative around stem cells that started 10 or 15 years ago. They created a novel regulatory framework to allow stem cells to be researched and provided to people there. It was great for their economy. It was great for everything. It was great. The medical research turned out well. There were no weird scandals or anything. And everyone was very happy with it. And so they decided to take it another step further and create a new regulatory framework to allow not just normal stem cell therapy, but a wider varieties of new biologics for longevity, health span, life extension, advanced regenerative medicine beyond stem cells. And we recently also were commercially approved by the Ministry of Health to offer the Follistatin gene therapy there in the Bahamas.
Okay, wow.
That just happened this year as well. So very, very excited to be moving forward both with the right to try states, with the FDA's new initiatives to really accelerate this for America, the Bahamas, Japan, and the Middle East.
Okay.
Everything is really changing, you know?
Yeah.
Since I was a kid, when I was a kid, I was like, oh, the government never changes. Nothing ever changes. It's all the same. The only thing that's changed is the internet. But the internet, I think, has finally started to change everything else. People have really gotten with the program. They've gotten more access to personal health information. There's so much great information about nutrition and exercise and peptides that people never had before. And I think that is also because everyone in the world is getting more informed about personal health and longevity. That is allowing the regulations to basically loosen up and give way towards allowing people to get more access to both what they want, and then, you know, these same people are inventing new amazing things. It's not just Minicircle that's invented new amazing things. There are tons of great ideas and inventions that I see coming out that my friends and founders are bringing to light, and these things really need to get out into the world and serve people. It's not enough for scientific discoveries to be made in books or in a lab, and for the scientists to be like, haha, I made such a great discovery. I understand something no one's ever understood before. You know, that's great, and we really need to get that into service so that everybody can absorb the benefits, and not just people with disease are being helped, but really everybody can get improvements in health that are made possible with new science and new understanding, and self autonomy. You know, every person has to make a choice to heal. You know, I've worked with a lot of patients. I just know a lot of personal stories from friends and family members. A lot of times people with the worst diseases, it's kind of weird, you know. Maybe they've had all the best doctors try to help them, and all the doctors miss something. At the same time, people oftentimes are not, you only kind of get the exact help you need when you yourself are open to it and kind of seek it out. It's not always just like given to you. You have to try. So, yeah.
Yeah. No, that's a really interesting point. I want to go back like slightly to when you were saying it sounds like there's almost like a space race, but for like biotech regulation. No? Do you think that has come about because people are more informed and therefore they're putting pressure on regulators, or why do you think this has come about now?
Yeah, I think the regulators feel safer because people are more informed. I think there is more pressure, both from patients and even like the regulators themselves. Just more people, more of these bodies, they're more informed. So it's not like the asymmetry or the power symmetry is not as intense, where you're like, oh, these people are predators and these people are helpless and we have to protect them, and you know, that type of thing. It's a little bit less like that, but I think what's really going on that is really being picked up on is that the jurisdictions are competing because they can see the value of the therapies is there. It's already established enough, or smart people that are in power have already identified or realized where this is going, and they want that economic activity, they want that value in their country or in their jurisdiction or in their state. You know, in Montana, in New Hampshire, this has been what it's like. It's been like the power and the economic value and the health value of these new inventions is so compelling. We need to, vitalize our state and bring that innovation and those jobs and those factories and, take care of our people. That's what I've heard from people in governance in those states. And that's what I've heard in Japan. That's what I've heard in the Middle East. That's what I've heard in the Bahamas. I think that's what's going on with the FDA as well, because they know that other countries, including China, are making these regulatory and governance changes in order to try to get a step up on medical innovation. The FDA has really started, I think, feeling the heat as well, because the US, of all places, doesn't want to get left behind and have other countries advance on them where they were stuck. That's not happening. So I'm seeing changes in all these jurisdictions, and I think the real tone and the real reason is something more like this, in combination with the fact that just having broader, more ambient knowledge about all these things, comfort, safety, presence, and culture. We've had activists for many decades work hard, since 2000, basically, to provide credibility and reality to the concept of science allowing changes to the very nature of aging to occur. People like Aubrey de Grey, for decades, people called him crazy. Scientists were like laughing him out of the room. Even Brian Johnson, when he started, people were like, who is this weird guy? But more and more every year, people are starting to realize that this is real, and we have the opportunity to really improve our health and to potentially extend lifespan. There have been new cancer treatments and cancer cures invented and tested that people didn't expect. The possibilities can be realized if we invest in it and commit to trying it out. I mean, look at what's happened with everything else. The world has changed. Regulations have changed around cannabis, around psychedelics, around crypto, around a lot of things. The internet's changed the world. We've seen that happen. So I think space race is a good comparison or metaphor.
Nice. How much of an impact do you think the regulatory kind of bottleneck has had on the progression of longevity? Not even just research, the impact of that research on kind of our own lifespans.
Yeah, I mean, I think it's basically 100%.
Oh, really? Okay.
Like the science has been there for so long for so many of these things, and having a single authority that is difficult to navigate for the average inventor, and then that requires oftentimes a decade plus of experiments on people that where their consent, it's more like the consent, it's been a lot more regulator consent leaned than individual consent leaned. There's this assumption that I think that's wrong about a lot of historical clinical trials, where you want to recruit people that know that they're in a clinical trial, but how well do they really understand the design of the drug they're treating? So many aspects of it are desired to be totally objective, like the patient in the trial is just an object that is the same as every other one. But that's inherently against the nature of medicine. Like medicine is, so much of it is really in the subtlety, and it's in knowing the health history and the lifestyle of the patient and the relationship the patient has to the provider. That's, I think, a lot more the reality of medicine. And in the industrial pharma post-World War II paradigm, it was very much like, this is a factory, people are objects, this is a scientific study, we're studying how humans react to this probe. And I think that just results in, I think there's a lot missing from that, from an ethical and care providing standpoint. Providing care should start at the beginning of the invention process and be kept the entire way. You know, the way that medicine was done before modern clinical trials was actually great. You know, physicians would try new things. They had the freedom to do that, and they would report on the results through medical journals. And they would try it maybe on one person, do a case report, the other doctors would evaluate it, and then they would gradually expand it through many people and then continue reporting the results. It was all very organic, basically. It wasn't so, there wasn't a phase 1, phase 2, phase 3. You know, there wasn't even really, you know, IP and copyright are relatively new inventions in history. Going back even further, you know, medicine, I used to joke about, you know, Einstein didn't create his theories of relativity in order to IP protect them. You know, Bach created all of his works before copyright was ever even thought of. Humans have been creative for millennia before these recent legal structures have been created. And most of the history of medicine does not really look like what, you know, RCTs look like, or what all these recently developed ethical structured frameworks have looked like. The history of medicine, ethnobotany, and healing work was legitimate in many ways, and science is great, but there's a lot more to it.
Yeah, I think like what I've read from some of the critics of like right to try, for example, they see kind of things like FDA as like a standard that people have to adhere to, so everyone knows that it's safe. How can you maintain a certain level of standard while having something that's like organic and peer-reviewed and more like what you were talking about before all these kind of things come into play?
I really believe in just naming the things, naming the different standards. There can be more than one standard. Like I think Jim O'Neill has advocated for decades for the concept of, okay, this drug has been safety approved. It's passed a phase 1 trial or a phase 2 trial or a phase 3 trial in safety, but maybe the efficacy hasn't been formally reviewed by FDA. If we're optimizing for safety, you could theoretically have a label or have a website where people can look up, okay, the FDA has done this type of safety review on this dosage, and this is approved or not. The efficacy review, you know, it's not like the past too. Like you could totally, like the FDA could be, I don't know, replaced with a website that you can look up every, you know, medicine and drug that is approved to be on the market, and you can see what the efficacy outcomes were in each study or for each disease, and just look at, you could just look it up. That's not available. I don't know why that's not out there. That's not on the website. You know, the safety is like, okay, safety compared to what? You is this safe for everybody? Is this safe for people with certain diseases? I really believe it's possible to communicate that to people in a more high resolution way than a simple, yes, it is completely safe and effective. No, it is not safe and effective. We got into that type of trouble with the COVID vaccine. It was emergency approved in the shortest amount of time ever for a therapy like that. And it was given infinite, yes, safety and efficacy. That's what everybody was saying. And now not everyone totally believes it was infinitely safe and efficacious. But that's, the nature of that type of approval process ultimately leaves out so much information. It's just ultimately untrue, because no drug is completely safe and effective for everybody in every case. It depends on the dose and the person, and a lot of times there are people that have bad reactions and that type of thing. So I believe in a tiered system. Just name what the research has shown, and allow people to look it up, allow doctors to be able to look it up. A lot of times it's the information needs to be accessible. I think that's critical. And then you could also that way, if you have different categories of information, like look at what people do with food products, for example, or in other types of regulated product industries, there are essentially these nonprofit entities that just certify products as having passed different types of safety tests, or this product was manufactured with this level of sterility, and it's just labeled like that. Or there's like halal, and there's different religious certifications where there's the biodynamic certifications where auditors go out to the farm and check if they were really adhering to those types of standards of growing food. And those entities, even not as non-governmental ones, are generally very highly respected. So it is possible to do this in more than one way. And I think having a plurality of options and a plurality of regulatory approaches where you have different levels of certification for different things is awesome. And you shouldn't have to earn one single certification that blanket approves everything. At the same time, I think the history of, okay, this drug is safe and effective for this subpopulation of people that have this specific illness that is defined by FDA is also very limiting for people. It's hard. There's obviously the off-label option where if you get a drug approved for anything, doctors have the autonomy to do off-label prescription to an extent. But even that is tough to manage. And then, how do you market, or how does that company get to people that don't have that rare disease? It's fraught, and it's limited things. So like two things I think of with that are, I was studying recently, like the last two, I think the only two drugs that were approved for the use of female libido enhancement. And the first one, flibanserin, trademark name Adyi, I think, the pink pill, they had really already completed their phase 3 trials years before. And then the FDA was like, no, this is not like a national priority. This is not important enough of a disease. This is not a real disease. And so that company had to go on a multi-year propaganda campaign, appealing to feminist ethics and like lobbying politicians and the FDA in order to get another review. And then they were like, oh yeah, actually, okay, this is this is good. And they didn't even do more science studies. Like, they had already completed everything. And so at the same time, you know, coming at this from the level of being a startup founder, it takes a lot of money every month to just keep the company alive. The burn rate on a pharmaceutical company that is pre-approval is huge. So the FDA basically decides whether or not a company or a invention lives or dies based on the ambiguity of when the approval can come. And that approval has, a lot of it is based on if the FDA at that time has decided this disease. First, the FDA defines what a disease is and what it isn't. They have classes of, okay, this disease is this, and then there's people that are sick but they don't have a diagnosis. How do we get to them? And then they have priority levels, like, oh, this disease is high priority, this is a rare disease, this disease is not a full disease, it's just like a symptom situation. So, you know, how do you navigate that? I know a lot of it has to do with the payer system, with legality. If the FDA has certified this as a disease and this drug is used for it, then, you know, insurance and Medicare can cover it, and they can't if it's not. But this has resulted just in so much losses too, so much losses of patient care, and it just lets a lot of reality go unacknowledged. And when there's a single authority that controls the ontology of disease and creates, you know, boundaries and definitions and names things, then you're just going to have an inherently limited view of reality. And that's going to result in drugs and drug companies that conform to that view. And, you know, it's important to constrict and structure things, and wherever you're missing people that don't fit into that structure, they go suffering for their whole life, potentially without medical care. And that is, you know, that cannot be allowed. We have to do something about that. You know?
Yeah, no, definitely. I'm curious, when you go into your trials, how do you do that whole process in terms of like accepting applicants and all that kind of stuff?
Yeah. So, I think the process of recruitment for these clinical trials can be one of the most interesting parts of the process. And, you know, it's a different process than a lot of engineers or business people that might get started into doing a pharma startup are familiar with. You know, a lot of it comes down to determining, I think, if the patient, if the participant is a good research candidate. And that includes a number of different things. One, are they sovereign, familiar with their own health, and able to respond effectively to anything that goes wrong, take responsibility for it, call a doctor, you know, are aware, on top of their own health. You know, then there's like how that kind of connects to how stable the person is. Maybe the person is like so attracted to trying this new therapy, but they're actually also schizophrenic, or they're prone to anxiety attacks, and they really want to do it, but some part of them isn't fully consenting, and maybe they're even trying to hide that. You kind of have to personally, you know, lock in and connect with the person in order to tell if you're really getting, if their statement of consent is really full consent. And And then if it is a clinical trial, the agreement is really for them to provide data. It's not just to take the therapy. And people need to follow up with their data. That means they show up at specific times on a schedule, and they go through various batteries of testing that may include lots of blood draws, which not everyone enjoys, may include various tests of behavior and intelligence or whatever, all kinds of things. They might have to pee in a cup again and again. So, we might have people over 6 times. And those people, that cuts into the time of the day. That's an agreement that they are making when they join the trial. Sometimes people just want the therapy and they want to get out of there.
Has that happened before?
Oh, yeah. And then there's also, like a lot of high agency rich people.
Okay.
They may have a lot of consent. They may be able to pay for the diagnostics and all that stuff. They may know all about it, but they have busy lives and they can't commit 6+ days to submitting to a clinical trial testing procedure. That's a great example of someone that actually just wants to pay for the therapy and then go back to their life. Lastly, I'm also really looking for people that are sensitive to changes in their body and mind. People that have experience with their own health, with their own biohacking, maybe even with psychedelics or performance-enhancing drugs. Just people that kind of have a lot of self-awareness and can articulate what has changed. Not everybody is completely dropped into their body, sensitive to their own psychology, and can easily name, oh, this has changed, or I'm peeing more, or I'm noticing this. So those are kind of the tenets and paradigms, and it can be different with different drugs or different therapies, cell therapies, whatever.
So looking at the current landscape for regulatory innovation in biotech, the space race, all that kind of stuff, do you think we're kind of on the brink of genuine restructuring of how the world approaches biotech innovation? Or is this still going to be kind of a thing where the jurisdictions compete and not everyone gets access, basically?
Yeah, I think this is the year where I feel like I'm seeing restructuring. I've always been very skeptical, maybe more than most, very skeptical of any type of regulatory restructuring actually happening. Usually governments or people want to advocate for it or say that they're willing to do it, but this is the first year that I feel like I'm seeing things actually changing and allowing legitimately new advanced biotech therapies to be welcomed, to be explored, studied, and made available to people, not just seen as research artifacts in sterile NIH-funded laboratories.
How much of a impact do you think was made by these smaller scale, like Próspera, or the really smaller scale charter city approaches to regulation in this field? Do you think it was impactful at all, or is it?
I think the choices that have been made by Próspera and probably by Minicircle as well can kind of compound it, because no country, what I was seeing before was really no country, especially not a bigger country, but also not smaller countries, wants to be the first to try to allow something to happen that no one else has tried before. But I think people have taken note of both new innovations occurring in the traditional regulatory system, the like GLP-1 agonists being like semaglutide, Ozempic, kind of starting to be almost like a longevity drug rather than a drug that's treating a specific disease. And then people were seeing a lot of development in China with their clinical trial framework there. And then there were these more radical experiments like what Minicircle did in Próspera that actually turned out really great. It wasn't a catastrophe. People had great health outcomes. Brian Johnson did it, made a video about it. And more and more people have been trying it and been like, oh, this is working. This is okay. Things can be good. I think my challenge to the world has always been, okay, so the world is like this, but can you imagine how much better it could be and what the possibilities could be? They could be much, much more positive. So yeah, I think smaller countries being willing to try things, both from starting at Próspera at a very, very nascent level, that helps governments and people that work in government to feel more comfortable and see, okay, this has been tested, experiments have happened, this can work. There's also been a lot of work in the background by these regulatory agencies, particularly in the UAE, in the Bahamas. People have put a lot of design work into, okay, what would a regulatory system look like if we designed it from scratch today, looking at what we've got instead of, like FDA was kind of designed a very long time ago and it is very big and has to incrementally adapt to changes in the economy. So, I think there's been a lot of background work that's been done in private by these governments, by these regulators, in coordination with consulting firms and, bioethics and philosophy. A lot of work has been done that's really only now becoming certified. The orders are being signed. People have discussed this for long enough, and the time has definitely shifted. I think also with AI, I think AI has really forced a lot of people to be like, okay, things are really changing, and just having, I think there was a quote by maybe Dennis Diderot, I'm not sure, an old philosopher about history and times in Europe and stuff, and something of the nature of, like, there are certain times where society kind of melts and everything becomes plastic and a lot of changes can happen and everyone's just in on it. They're all seeing, okay, it's time to redo everything. And I think we have entered that type of timeline. And I think AI has a lot to do with it, as well as, of course, the internet has been around for so long. People have really gotten used to it, and it's not just a new thing for nerds. It's part of the infrastructure, and when you get new infrastructure benefits that are accessible to everybody, then after everyone gets on board, you can kind of reach the next level of civilization. So I think that's what's happening.
Okay. Nice. Well, that's a very positive kind of optimistic. It makes me very optimistic about the future, and I'm going to leave it at that because that's a great way to end it. Thank you so much for listening to this episode. Subscribe, like, share, and go and look at Minicircle's website and all of the stuff that they're doing. Bye.